Hi, my name is Karleen Sakumoto. I'm the manager of King County Employee Health and Wellbeing in the Human Resources Division. And today I'm going to be going through a presentation about how you need to get ready for open enrollment. So today's agenda will cover three areas. Number one, an overview of medical plan choices for 2018. I'll show you some of the tools and resources we have made available to you. And we'll talk a little bit about other benefit plan changes. Open enrollment this year is November 1st through the 15th. This is the one time a year that employees get to make changes to their medical plan option unless there's a change in your family status during the year. Typically, people don't make a change in their medical plan choice, and you don't need to go into changes during open enrollment. But this year, King County is introducing a new medical plan. You may have heard about it by now. For the first time in 10 years, King County employees will have a new health plan option called CareSelect. CareSelect is offered by Regence Blue Shield and joins KingCare and Kaiser Permanente's Smart Care Connect as one of three medical plan options for 2018. I'll talk about CareSelect in just a bit, but first, a few points regarding choosing a medical plan. Now is a good time during open enrollment to look at your current plan and compare the three medical plans to find the best fit for you and your family. It's important to understand what's covered and what you will pay to get the care that's right for you. A few things to think about as you compare the three plans. Review each plan's details carefully. It's important to understand what is covered and what you will pay to get the care that's right for you. The medical plan quick comparison charts will be especially helpful. They're located on the Open Enrollment website at kingcounty.gov/open enrollment, which we'll take a look at later. Look at other features that are important to you. For example, access to high-quality care or additional programs and services to help you be healthy. Second, search for the providers and facilities you know you want to use. Be sure providers and/or facilities you want are in-network. If they aren't, you will pay more to see them. Be sure you can get in-network care close to home, school, or work. Look to see if there's a covered primary care provider, a pharmacy, an urgent care, and a hospital nearby. See if there are options for care that don't require you to come into a provider's office, such as email, phone, or online visits. If you seek medical care often when traveling, or if you have dependents living outside the area, like college students, be sure in-network doctors are nearby for affordable routine care. And finally, talk through your options with your family to make sure your medical plan fits everyone's needs. Consider the needs for each person who will be covered by your plan, as some plans require everyone you cover to see providers in the same network. So let's watch a short 2-minute video message from Dow Constantine with information on how to choose a plan.
Hi, today I'm excited to tell you about a new medical plan option. We'd like to give you some information to help you choose the right plan for your needs during this year's open enrollment period. King County cares deeply about you and your family's health, and we want to give you the tools you need to make the best decision possible.
For the first time in more than 10 years, King County employees have a new medical plan option. CareSelect by Regence Blue Shield joins Smart Care Connect by Kaiser Permanente and KingCare by Regence Blue Shield as one of three plans for you to choose from. Now is a good time to review your options so you can make the best choice for you and your family during open enrollment. Your health is important. Make sure you have the right amount of care, coverage, and convenience you need to be healthy. Here are 5 questions to ask yourself as you make this crucial decision. Who will be covered by your medical plan? If you have a family, make sure to choose a plan that will meet everyone's needs. Are there providers you want to see or facilities like hospitals you want to go to? Use online provider search tools to be sure providers are in network. What upcoming procedures, prescriptions, or other things will you need covered? Make a list so you can check how plans cover them. How much do you want to pay? Or how much can you afford to pay? Think about deductibles, co-pays, prescriptions, out-of-pocket maximums, and other expenses. How do you want to work with providers? In some plans, you have a primary care provider who works with you to coordinate your care. In other plans, your providers are more independent and they might not know what your other doctors are doing unless you tell them. We've created many tools to make your choice easier. We want you to feel confident as you make this important decision.
We know costs are an important part of your decision on choosing a medical plan, so here's a quick at-a-glance comparison on the three plans. When you look at the plans, Smart Care Connect offers the lowest out-of-pocket costs and no deductibles. On the other hand, King Care has the highest out-of-pocket costs. Another way to look at the plans is how you will work with the healthcare providers under each option. Both Smart Care Connect and King CareSelect offers more integrated care, where providers are coordinating your care behind the scenes, sharing electronic records, and working as a team, while the King Care plan will rely on you in many cases managing your own care. As you know, group health is now Kaiser Permanente. They continue to offer the great benefits as members have had in the past. Medical and pharmacy plans, for instance, are under one plan. And members can stay connected through electronic medical records shared with patients and among all medical team members. Those of us who follow what is occurring in the healthcare market consider Kaiser our top-rated plan. We encourage you to take a look at the awards and recognitions that Kaiser has received locally and nationally. A couple of exciting new developments to note. Members can now receive coverage outside of the Puget Sound region. Before seeking care in these other regions, members must call Kaiser Permanente Member Services to set up visiting member access. Kaiser Permanente recently announced a $400 million renovation and redesign of their Capitol Hill campus. This will be exciting new facility for all of you that are in the Kaiser plan. Now let's talk about the new medical plan option, King CareSelect. On the cost comparison table, it was nested in between Smart Care and King Care. It's because the out-of-pocket costs employees are going to pay is in between those two plans. King CareSelect offers employees a choice between 4 accountable health networks in the Puget Sound region. In an accountable health network, you're connected to a well-rounded network of local providers working as a team. They go beyond treating illness to focus on total health and wellness. The 4 networks are Eastside Health Network, Evergreen Health Overlake, the Everett Clinic, Multi-Care Connected Care, and UW Medicine. One question we've heard from employees is that they want to know which hospitals and medical centers are associated with each AHN. Here's an at-a-glance look at the facilities within each of the AHNs. You'll see some facilities belong to more than one AHN, but generally, medical providers are part of only one of these networks. So be sure to use the Find a Doctor search tool for each network to check for providers, therapists, and specialists. I'll show you in a minute about the Find a Doctor tool. There are brochures available on this page that will help you learn more about the options under King CareSelect. So here are some key points about King CareSelect that you need to consider before choosing a network. With King CareSelect, you'll have a team of doctors led by a primary care physician that you choose. Your PCP will help coordinate care among your providers. You may self-refer to specialists in your network. King Care is local by design and by region. On the website for each AHN, there are maps that show the geographical regions, so be sure to check that out. No gold, silver, or bronze tiers for King CareSelect members. The same low out-of-pocket costs apply to everyone. You must choose one of the 4 networks during open enrollment. Each AHN network is separate. When you enroll in one, the other 3 are considered out of network and you'll pay more to use them. If you or one of your dependents, for example, a college student, lives outside of the network service area, CareSelect may not be a good choice for you. And finally, a portion of your 2018 deductible is waived. I wanted to make you aware about the Find a Doctor search tool that you can find on our site. Here's what it looks like on our open enrollment page. Here's where you'll end up. This is a Regents website, since Regents is offering the AHN networks. But it's important for you to note, please use the links from King County's website. It may be confusing to go directly to regents.com and search all types of doctors, such as primary doctors, physical therapists, massage therapists, that you may want to use. A few other benefit changes for next year. FSA increase. If you're not familiar with a flexible spending account, or FSA, it's a great way to save money on medical expenses and dependent care by using tax-free dollars. For medical expenses, for example, you set up a pre-tax amount from your paycheck that you use throughout the year for expenses such as deductibles, co-pays, medicines not covered by insurance, and it's tax-free. If it's dependent care that you're worried about, you can use FSA money for expenses such as child and adult care, preschool, and before and after school care. There is also going to be a change in the definition of domestic partners covered under King County's plans. Your benefits will no longer be offered to unmarried partners and their children, unless you are a state-registered domestic partnership with one partner who is 62 years or older. On the back end, we will be having a new administrator help us with administering the FSA and COBRA accounts. So here's a quick summary of the resources and what you need to be thinking about during open enrollment. Please be sure to go to the URL that's noted for more in-depth information. From November 1st through the 15th, be sure to go into PeopleSoft to make your benefits choices. If you want to make a change to your medical plan, you must do this during the open enrollment period. Finally, if you need assistance, please call the King County Benefits team. Thank you for joining me on this presentation. Hope you learned a lot and it will help you participate in this year's open enrollment.